My name is Dr. Victoria Mosteller, and I am a clinical investigator with the Encore Research Group. Our facility has conducted over 2,500 clinical trials, and we currently have 90 active enrolling studies. I love doing clinical research in a variety of things, but I especially like vaccines. I would like to talk to you today about a very specific vaccine, an RSV vaccine. RSV is an illness that can cause a simple cold but readily can progress to severe illness in susceptible individuals. RSV stands for respiratory syncytial virus. It's a respiratory virus that causes syncytial to develop. Syncytium is a word that denotes a property of this particular virus where two or more cells can get together and make one big blob of mucus. Similar to droplets of oil on water, if you were to shake it, they coalesce together to make a blob of oil. It is this property that turns this simple cold into a much more severe illness in susceptible individuals. It is a very contagious virus and spreads readily when people are sneezing and coughing through the air. Another property of this virus is that it can last for hours on hard surfaces. So when infected individuals touch their eyes, nose, or mouth and then touch other things, they lure the germs behind for other people to pick up. The other property of this is that it causes the worst runny nose of your life, as I was taught in training, and in fact produces many secretions. In little children, this is especially problematic because they leave their germs all around. They touch other children and toys with their germs and then spread it to other individuals, such as caretaker and especially older individuals. This virus can actually be an illness you can get more than once in your life. In fact, you can get it even more than once in a season, creating significant disease in communities. The illness generally lasts 7 to 10 days, with day 5 being the worst. Generally, people are infectious for 3 to 8 days during their illness. However, some individuals can actually harbor these secretions with infectious virus in them for up to 4 weeks. Each year, there are over 177,000 individuals who are admitted with this disease that are over 65 years of age, with 14,000 deaths in this patient population. But many of younger children who get this go on to become asthmatics. There's a greater incidence of that in the younger patient population and COPD in the adult population who contract this RSV cold. I work in the emergency room and the number of cases is skyrocketing, both in the young and the old. I've seen young children suddenly become very compromised and have difficulty breathing, resulting in admissions and even ICU admissions, as well as adults who have been struggling with their cold and later go on to the ICU. As our lifespan is increasing in this country, we are seeing more and more of this illness, and it is exciting that we now have the opportunity to vaccinate people who are greater than 60 years of age. This will not only help this patient population to decrease the incidence and severity of this disease, but will also help us ultimately to decrease the spread even to younger children. I invite you to be a participant in this study if you are 60 years of age or older, or know of somebody who is and might be interested. Knowing, of course, that, again, at the risk of repeating myself, that this is not going to only benefit the patients that receive this vaccine, but some of the younger children who may contract them from the older individuals when they do have this. It also lends to our further research of being able to develop vaccines for other age groups. If this study isn't a study that you would be interested in, we have multiple other studies, and we invite you to contact us should you want to participate in a research trial.